back to Healthy Living. Thank you for your company. 131873 is our number, and Dr. Ross Walker joins us every Sunday night. You can as well. 131873.
Cardiovascular disease is no doubt the biggest killer around the world. In Australia alone, one person dies every 20 minutes from this disease. We now have excellent treatments if someone makes it to hospital, but often the follow-up is a little bit lax. And it's my opinion that all patients with acute cardiac disease should be followed up with some form of cardiac rehab. Tonight we have in the studio Dr. Christian Verdicchio, I'll ask him how he pronounces that properly, who's the Heart Wellness and Cardiac Rehab Manager at Macquarie Health Corporation. Good evening, Christian.
Good evening, Dr. Ross.
Tell me the right way, the right Italian way of pronouncing your last name.
Christian Verdicchio.
Verdicchio.
Roll the R's.
I love that. I'm actually porcilingual. I struggle with English.
You're an adopted Italian, apparently.
I am an honorary Calabrian citizen because of my services to the bergamot fruit, but it doesn't mean I'm any good with the language. But anyhow, now, can you explain to the listeners what is actually cardiac rehab and what's the difference between that and heart wellness?
Yeah, look, cardiac rehabilitation is really defined as a process where someone would present with heart disease, and then they go through this multidisciplinary approach to try and get them back on their heart health. So they've had their surgery, they've had their acute event where they're medically stable, and they go through this complex intervention where they get exercise therapy, which is very important. Mm-hmm. They get attended to their cardiovascular disease risk factors, so things like weight loss, alcohol, cessation, and in conjunction with smoking cessation as well. And also they're going to be attended for, in terms of the educational purposes, which is actually a key component. So ultimately you're trying to empower the patient to understand to make the best long-term life choices to get on top of their heart health. Cardiac rehab or cardiac rehabilitation is well defined in the world as a term. Personally speaking, I don't like the terminology with all my research background and academia background in exercise cardiology. The program that I manage at the moment across multiple rehab sites is the Heart Wellness Program, which is our take of cardiac rehabilitation, but the connotation with cardiac rehab is typically seen for older patients, and it's something that's seen that people who have very low levels of functional capacity following their heart diagnosis or their heart intervention. Whereas we're trying to say, well, hang on a second, you've got diagnosed heart disease, but whether you're in your 40s, your 50s, or your 60s, we can tailor an exercise and lifestyle intervention program for you, because at the end of the day, if you are fairly active, you've still had an event, so something needs to change. And we want to really try and drive some significant improvements. And I think heart wellness captures the entire area of what we're trying to do.
You see, this is the problem that I see. People get into hospital, and these days the big push is to get them out quickly. So they've had this stent, they'd be lucky to have 2 or 3 days in hospital after a stent. Mm-hmm. Bypass surgery, they'd be lucky to have a week in hospital after that. But in that time, they're often too shocked, too sick to really take in any good information. And that's why I'm a really strong supporter of a viable, well-proven cardiac rehabilitation, or even better, as you say, a heart wellness program. So can you explain, though, is there any evidence to show that there is heart events that are going to prove that cardiac rehabilitation actually works, or is it just sort of a nice thing to do?
Well, we can talk about it from 2 perspectives. I mean, we know with having healthy levels of weight, having higher levels of cardiorespiratory fitness or physical activity levels, you're less likely to develop heart disease. On the flip side, if you have heart disease, you've had an event, you've had a surgery, if you're able to again attend to your lifestyle risk factors such as your weight and those type of things, especially getting on top of your cardiorespiratory fitness through a tailored exercise program and doing it quite regularly, independently exercise alone can reduce your long-term outcomes of having another cardiac event, can increase your survival rate significantly. In fact, to the point where we now know that if you have by improving your cardiorespiratory fitness level, even though if you have heart disease, we can actually have the same outcomes compared to someone who doesn't have heart disease. So it's quite achievable. The guidelines at the moment state around 150 minutes per week of physical activity or exercise. That's probably going to shift in the near future. All the research and the data abroad kind of shifting towards more than 210 minutes, which equates to about 30 minutes a day of aerobic physical activity or exercise. And that's where we really push it with our program in terms of the Heart Wellness Program. And what we're trying to do is trying to show that we have a program is also preventative. where people can come in from a prevention side of things to try and stay away from hospital. We have a program that is also able to really push patients, whether it's using modern forms of what we call interval training, which is very, very beneficial for cardiac patients. And at the same time, we also are quite unique that being a private rehab provider, we're actually able to follow up the patients when they leave us.
Yeah, but you're still talking too much about exercise. It's not just about exercise. A heart wellness program has much more than that. Now, you alluded to that before.
Yeah.
But one of the big things that people, and I've got to say, I've been a cardiologist for well over 35 years and practicing medicine for over 40 years. I've never seen one person in that time who's had a heart attack, stent, bypass, stroke, who wasn't under some sort of stress at the time. Now, some of it could be physical stress, I accept that, but it's also the other stresses. What do you do in your heart wellness program to help people learn to cope with stress better?
Great question. So, when patients were to come in to see us, and typically this is the same even for tertiary hospitals as well in the public sector, you'll get seen by a cardiac nurse. They'll go through your lifestyle risk factors. They'll provide you with the education around what you've had and really trying to provide you with that information for the long-term outcomes to understand you have to change your lifestyle. You'll see our exercise physiologists. They'll go through your cardiorespiratory fitness testing and your regime along with the physio. We have an OT. We have a dietitian because I understand weight loss is key.
And just general nutrition is key as well.
100%. Yep. And also we have a psychologist involved in the team. And the psychologist, is really important because, some of the questionnaires that we screen for patients in cardiac rehab are around depression. The questionnaires that we use look at anxiety and depression. So you may get patients who, from a depression side of things are quite okay, but they're quite anxious. So they've just had an event. They've had a heart-related event, as you would understand, and so the psychologist is also able to attend to their individual needs to help them facing their psychosocial issues at the following present moment as well. So we really do offer, a multidisciplinary approach to cardiac rehabilitation in our heart wellness program. And to be honest, we're actually the largest private rehab provider for cardiac rehab in the country. And also at the same time, we're very unique because we can actually give patients the opportunity who require intensive inpatient rehabilitation following their heart event. We do have that available. We're typically a private rehab hospital, so that's kind of the primary basis of our model. We do the outpatient, which is predominantly where most of the cardiac patients are going to come from. Let's be honest, they go into hospital, they have their procedure and they're discharged, so they're going to most likely come to the outpatient. But also we have what they call like the phase 3, cardiac rehab, and this isn't offered because in the public sector, they just don't have the funding or the resources available. And what we know, especially from my research back in Adelaide, is that, really trying to achieve good long-term outcomes with patients is a lifestyle change. And they do need follow-ups during the remainder of the time period.
So what sort of hard evidence do you have that this stuff works?
Well, actually, there was a really interesting study that came out just recently in the American Heart Association. So they looked at around 3,000 patients. It was an observational study, so between 2002 and 2012, and there's so much evidence on cardiac rehabilitation, but this one here sums it up nicely. And what they looked at was those who partook in cardiac rehab sessions, and they quantified it. So they said, okay, if you did 20 sessions following, your discharge from hospital of cardiac rehabilitation, 15 sessions, 10, and below 7. And what they found was that those who did more than 20 sessions during that structured program, their 5-year risk of having a major adverse coronary event, so having another arrhythmia, a cardiac heart attack, any of these type of things, was about 40 to 50% lower compared to those who did less than 10 sessions of structured cardiac rehabilitation. What's scary about that, it's about 9 sessions to be honest, what's scary about that is that the average cardiac rehab sessions in Australia is 9.
Right.
So, you're on touch and go, really. If you're in the program that some hospitals do twice a week across 4 weeks, you're in 8 sessions, so you're not probably going to get that long-term benefit. If you're in those hospitals that probably do twice a week at 6 weeks, then, you're just going to get into some getting that long-term 5-year benefit, and if you know what I mean. Our program is 20 sessions, and I'm really proud of that. It's a 6-week program, 3 times per week, and it's really there to try and get the best bang for your buck in terms of getting these patients fit, getting the weight under control, attending to the cardiovascular disease risk factors, and setting them up for when they actually transition home.
Okay, so there's a lot of people who'll be listening now they've had a heart attack, they've had a bypass, they've had a stent, maybe even a stroke. So the questions there are...
Ablation,
yeah, something like that. But the questions they'd be asking is, okay, how much is this going to cost me? And secondly, how can I get in touch with these people?
Yep. So in terms of our reach in the Heart Wellness Program, we have 9 sites across Sydney, 9 private rehab private hospital sites. We have one in Melbourne as well. You just need to go to your GP or your cardiologist, and if you're under private health insurance through your hospital cover, you're actually covered for this. And there's 2 ways, or 3 ways typically you can go about it. If you've had an acute event where you're now medically stable, or you've actually gone into hospital or had a procedure, you're automatically entitled under your hospital to have this form of rehabilitation covered. The other one is that if you haven't had any of that, but you have established heart disease, you've become a little bit deconditioned as a result of that heart disease, and you're starting to have, say, a bit more symptoms in some way, with shortness of breath, palpitations, then that is also another way where you're actually able to be referred into the program and be covered under your private health hospital insurance.
But you're inferring that the public system just can't cope with this and are not really offering this sort of service. But with the evidence you presented to me, it should be that the government's looking at this and saying, if we can't do it in the public system, we should be able to facilitate our public patients to have this available in the private system. I
agree. I mean, the public system, and I'll be honest, they do a very good job with the resource that they do, and everyone that runs these programs always have some form of benefit. So I'm not here to talk down upon any of the public hospitals.
Sure, but, of course not.
And they do a fantastic job. But, the realities are, especially now during COVID, a lot of these hospitals now have gone to telehealth. Now, telehealth is great, but, to prescribe exercise and weight loss, you do need to see the patient. You do need to provide them with one-on-one. And supervise their sessions and things like that. So, I'm also saying during these time periods that, some of the hospitals are quite busy, especially the public ones. So you got private health insurance, you might as well take advantage of that, get bang for your buck, and actually come across and take advantage of something that's also probably closer to where you live. Since moving to Sydney, I realised the traffic's quite intense and the parking's not easy, especially if you're going to your bigger hospitals in the city. So we can actually, with our 9 locations across Sydney area, I'm sure we'll be able to cater something close to your home.
Give us a website and give us a phone number.
So phone number is 9692 7921.
So it's 0. So this is for people in Sydney. 02
9692 7921.
Okay.
And we'll be able to put you in terms of some information across our hospital sites.
All right. Well, great. So and is there a website?
Yeah. So website is www.heartwellness.com.au.
Oh, that's pretty simple. So we'll have you in after the break to talk about something slightly different to this.
Part 2 of our chat with Dr. Christian Verdicchio. Did I say that right?
Yes.
After the break, you're listening to Healthy Living. Yes, welcome back to Healthy Living. You're listening to Dr. Ross Walker, and he's joined tonight by Dr. Christian Verdicchio. I'm trying to say. And I stuffed it again, didn't I?
Who is the Heart Wellness and Cardiac Rehab Manager at Macquarie Health Corporation. But Christian's also done some seminal work with Prash Sanders Group in Adelaide on the links between atrial fibrillation, exercise, obesity, etc. He's published a lot of really fascinating work. And we're talking now in this session about atrial fibrillation and its effects. So can you explain to the listeners, Christian, what is atrial fibrillation?
So atrial fibrillation, first of all, is actually the number 1 arrhythmia in the world. It affects nearly about 5% of the global population. And actually now in Australia, it's actually the number 1 cardiac cause of hospitalisation. So it's surpassed that of heart attack and heart failure. So it is a common condition. It's a condition of the heart, which is an electrical condition of the heart, which causes the upper chambers to fibrillate or beat irregularly.
I say quiver.
Perfect. Yep. You're the cardiologist, so you know just as much as me. So in terms of, causing an irregular heart rhythm, and with that, you have changes in terms of the patient, that they could start feeling fatigue, they have shortness of breath. It's definitely a stroke risk for patients as well.
I would suggest to you it's the commonest cause of stroke. A third of stroke is related to atrial fibrillation. And so when people think, I can feel atrial fibrillation, no, they don't feel the quivering. It's the ventricles, the bottom chambers that cop it. So that's what it is. And I say 1% of people up to age 50 have had a clinical episode of atrial fibrillation, 5% 60, 10% 70, 20% 80. If we all live to 150, we'd all be fibrillating because it's a wearing out of those top chambers. So how is it currently treated?
So atrial fibrillation is treated, typically, you have an episode, and depending on how long your episode is, or, how regular you're having these type of episodes and what you're classed as. Your cardiologist may get you on some form of medication, which is an antiarrhythmic or a rate control medication, or also control your stroke risk as well, depending. If symptoms are persisting, you may have what they call a cardioversion, so where they're actually shocking the heart to bring it back into a normal
under an
rhythm.
anaesthetic. If anyone's listening to this, you won't feel it. Yeah.
And also on the upper end is what they call an ablation, where that people are going in and actually getting part of their heart, I would say burnt in a way to try and stop where these electrical signals are coming from in the upper part of the heart where they shouldn't be, and causing the heart to beat irregularly. So they're kind of the general ways in terms of treating the condition.
Yeah, okay. So they're the ways of treating it. That's the standard way of doing it.
Yep.
And sometimes if you go to have bypass surgery for another reason, the surgeon can also do an operation at the same time to put you back in a good rhythm. But we've seen atrial fibrillation as a rhythm disturbance in the heart. People don't tend to relate it to lifestyle changes at all. But you've done some really extraordinary work and had it published in major journals. So explain, why is weight loss and exercise so important in the long-term control of atrial fibrillation?
Look, I was very lucky to do my PhD in a group under Prash Sanders in Adelaide who, when I had just started, they published big work in weight loss. And what we found was that we had known for a long time that the risk factors for AF were lifestyle related. So being overweight or obese, I should say, having hypertension, type 2 diabetes, high blood cholesterol, smoking, we also alcohol, high levels of alcohol intake as well. And obviously now low levels of physical activity or cardiorespiratory fitness. And what they did was they looked at this study. It was called Legacy. It was a groundbreaking study where they looked at getting someone to lose 10% of their initial body weight. And they followed these patients across a 4-year period, and then they had other groups that didn't lose 10%, they lost about 3% to 9% body weight, and those who didn't lose any weight at all. And after a 4-year period, they found that those patients who lost 10% of their initial body weight, and then also had got on top of their other type of risk factors, so trying to get their blood pressure controlled down, whether it's medications, and trying to get on top of their sleep apnea. If they did have sleep apnea, they took a CPAP therapy, cutting their alcohol down. They found all of a sudden that their freedom from atrial fibrillation was 6-fold. And what they then looked at when they looked at the actual heart and they look at what's happening underlyingly, the heart, atrial fibrillation is generally a progressive condition. For once, it actually reversed. And we found that the heart, the size of the atria, typically enlarged in patients with atrial fibrillation, actually reversed and went back to a normal size. The pressures in the heart went back to a normal size. The fibrosis within the heart itself, which also is a trigger for atrial fibrillation, actually significantly reduced. The heart, in all so many measures, actually reduced back to normal levels. That was pretty much the underlying reason why we saw atrial fibrillation freedom achieved in these patients and what we now call lifestyle or aggressive risk factor management. AF is now a lifestyle condition. Yeah,
and without wishing to sound indelicate, I've seen autopsy pictures of people who were significantly overweight, and 50% of their heart has been taken over by fat and scar tissue. And I don't think people realise that the big fat bellies you might see on people are also the big fat hearts and the big fat livers. And this fatty infiltration into our organs is incredibly dangerous. And I've had a number of patients who could lose the weight you're talking about, and they've become free from atrial fibrillation and therefore free from stroke risk. And you mentioned alcohol before. We have a thing called, which I'm sure you're well aware of, but the listeners may not be, thing called the holiday heart syndrome, where people go on holidays, they tend to consume a little bit more alcohol than they normally do.
We've seen AF actually increase during those periods as well. So there was a very high level study that came out a year and a half ago. I wasn't a part of it, our group was, and the group in Melbourne as well under John Cowman, who's a leader in AF, and they looked at alcohol cessation. They could only do it for 6 months because stopping alcohol for some people was had to reduce it.
6 months.
But in 6 months it was a significant reduction. So patients were told, okay, you keep your alcohol intake to less than 3 standard drinks per week, or they maintain their usual level. And those who actually
thought for a second you were going to say less than 3 per hour. But
I was very happy then.
It's going to scare a lot of people, but there was a 50% reduction. There was a 50% difference between the two groups. Alcohol is a big player now in atrial fibrillation, and when you tick the boxes, all the lifestyle, conditions of what they cause on the heart and how they change the heart. Weight's a big one. Sleep apnea is a very important one. You know, patients now who are coming into our cardiology practice back in Adelaide, everyone was getting screened for sleep apnea. It's a really important one, as you know of. And then, you know, people were getting turned on to, you know, exercise programs, because we now know exercise independently can actually achieve atrial fibrillation freedom, with some of the work that I was doing recently.
Yeah, so what sort of exercise helps atrial fibrillation? How much? What should people be doing? Is it more cardio, or is it resistance training?
Bit of both. Definitely more towards the aerobic side of things. And what we found was actually from two things, and was my PhD. So, you know, if you don't have AF, but you say you have a heightened risk of developing it, you know, getting on top of your weight, but also improving your cardiorespiratory fitness levels did significantly reduce your chance of developing atrial fibrillation. In those with AF, by actually undergoing and doing about 30 minutes of exercise a day. So we pitched that 210 minutes per week, as I said before. The current guidelines are around 150 minutes per week, but I do think they'll start to shift in the near future. And, you know, really trying to get at least 1 or even 2 sessions a week where you're working a bit harder, and we call that interval training concept, which may be. And so what we found was, if you're able to push yourself a bit harder, that 1 or 2 times per week, whilst on the other days just making those 30 minutes a day of walking or jogging, cycling, depending on what you like in the aerobic nature, you know, down the track we found after a 6-month intervention, that those patients, again, there was a 50% difference between the two groups, and those who were doing the exercise compared to those who weren't, and that was irrespective of weight loss.
Well, Christian, I've got to say, in my professional talks, I have a cartoon that says, what would you like, to be exercising for an hour a day, or to be dead 24 hours a day? Maybe it's not that funny. So,
actually, that's the one I always use in my talks.
Yeah, absolutely. Well, Christian, thank you very much for both of our discussions this evening. It's been very enlightening, and I'm sure the listeners would be very interested in what you've had to say. Thanks very much, mate.
Thank you for having me here.
And still to come on Healthy Living, Dr. Ross is going to quote Hippocrates and tell us about the latest research on the connection between healthy food and a good heart. This is Healthy Living. Welcome back to the program. You're listening to Healthy Living right around Australia. Our number